Welcome back to the program. And as we continue to keep tabs on the cholera outbreak, what is this, the management approach of this next public health emergency? We turn our attention now to Ogun State. And joining us for this conversation is the Commissioner for Health in Ogun State, Dr. Tomi Coker. Dr. Coker, good morning and welcome to the Morning Brief on Channels Television. It's good to have you, ma.
Good morning. Thank you for having me.
So what we're hearing from Ogun State is that there are 25 cases and 1 death confirmed so far. So bring us up to speed with efforts, to manage this, particularly in all the local government areas in Ogun State. And it might even be, worthwhile to also know if you've been able to trace the index case and, how it also spread to Ogun State, for starters.
Thank you. As you know, during the rainy seasons, there's usually a cholera outbreak. But on the 12th of June, Lagos declared an outbreak, and we actually had 8 patients diagnosed from Lagos, 6 of which had tiger nut milk in Lagos. So the first 8 cases that we had in Ogun State were imported from Lagos. This is not surprising, given that we share 4 borders with Lagos, particularly Ota. The first 6 cases were from Ota. And you have Obafemi Owode, you have Ifo and Shagam, and we've had cases there. But Ogun State itself has vulnerable local governments, such as Ijebu North, particularly a community called Okeagu, where we had an outbreak last year. And not surprisingly, we've had another outbreak this year. So of our 20 local governments, we have 7 where we've had outbreaks. Unfortunately, we had a death in Ijebu North, and it was a lady, a 62-year-old lady, who was taking care of her sick son and contracted it from him and lost her life, unfortunately. However, we've stepped up surveillance. We have disease surveillance notification officers in all our 20 LGAs, combing private hospitals, particularly because we've realized that 70% of the cholera cases are presenting to private facilities, despite all the awareness creation that we've done, that people should present to government facilities where adequate provision has been made by the government and NCDC for free treatment. And the adherence to the treatment protocol is better at our public facilities. We continue to escalate surveillance, particularly in the vulnerable LGAs that border Lagos and are vulnerable LGAs too. And we have, since the schools came back last week, school educators, they've been educating our children, and we've been screening our school vendors to ensure that they're disease-free, because a congregation where you have a large congregation of people are vulnerable points, and we're making sure that we're covering that. We've educated and created awareness, sensitized our private practitioners that when they see cases of cholera, they must report, and our ambulance service work 24 hours to evacuate those cases into our government facilities.
All right, Dr. Coker, we talk about people when they have diseases like this that easily people can get. What is the next step after the death of the person? Have the family members been traced to ensure, because this can actually be gotten by other people in the house through feces and other means? For the person who died, what has the government done in terms of tracing those around that person and maybe family members or friends that have come in contact with such individual?
So you're absolutely right. For every case, not just the people that have died, for every case, we ensure contact tracing, just like we had during the COVID outbreak. So we go into their friends and family and screen them, educate them. And also, when the dead person has, the government actually buries them. Because there's a protocol, there's a burial protocol for people who die of public diseases of public concern. So we take over the burial processes. We've been working closely with our environment colleagues who have been going into homes, ensuring sanitations, and homes that have been given notice to build toilets and have failed to, they've actually been prosecuted. And we've been visiting sachet water manufacturers as well, because we realized last year that some of our sachet water manufacturers were the focus point for us in Ogun State. So the Environment Ministry has been visiting the sachet water industry and testing their waters to ensure that they are coliform free, and coliforms are bacteria that are found in feces. So when they're found in water, we know that there's some form of contamination. The main menace is actually the open defecation, that a practice of our people, and also indiscriminate disposal of waste. And we're appealing to the public to work with us to keep them safe by ensuring that they dispose their waste appropriately, and that they desist from defecating in the open. We've constructed over 100 public toilets across Ogun State to try and provide sanitary facilities for people to limit this. The concern is we're really just going into the rainy season, and floods will be happening. Open defecation is all the feces from the open defecation might be swept into water source like wells, shallow wells, and these wells must be treated. We have chlorine tablets available for people to treat their wells. And if individuals want the Environment Ministry to come round to test their waters to ensure their safety, they are available to do that as well. And we continue to sensitize around our schools and our children and the public particularly. It's a disease carried by water and food. And so people must wash their hands before reaching out for their mouth. And cooking environments must be kept clean, personal hygiene, and ensure you boil your water. And if you can't, a drop of tiny chlorine in your water left for 30 minutes will do you a lot of good. Thank you.
Dr. Coker, I'm glad you touched on open defecation, and I'd like us to look at, just this route, Lagos-Ibadan Expressway. Ogun State is just next door. I wonder if there's any collaborative efforts between Lagos and Ogun State to managing open defecation on this route, which is a real challenge. You see it not just in Kara here, but along the expressway. Talk about Ibafu, Wawa, Mowe, all of those markets there. You also say that the state government has constructed toilets, but there's very little evidence to show that, in fact, that kind of infrastructure is being provided to stem the tide in continuous open defecation along this route. And who knows, perhaps the spread into Ogun State of the cholera outbreak that you're currently managing, is as a result of this kind of activity. So I'd like you to speak to that, Dr. Coker. Ogun State and Lagos work in collaboration. We actually signed about 2 years ago. There was an agreement that Ogun State and Lagos are going to work together on in many sectors. So that's ongoing. There's also the law that applies to all public facilities like petrol stations, restaurants, that they must make their toilets available for the public. So those are the things that are being done. If all petrol stations make their toilets available, Para in particular, as you mentioned, the express, Lagos-Ibadan motorway, Kara is being addressed by Ogun State and Lagos State jointly to make sure that they have toilets. And there's a lot of people who are displaced from different states that live under that bridge, that we are actually making all efforts to provide sanitary facilities for them, to help them, because they haven't made provision for those facilities. So it's up to the government to provide that. And we have been working on that. The Ministry of Environment has been working assiduously on that to make sure that hopefully one day we can actually make Ogun State open defecation free. Ikenne local government last year in Ogun State was actually declared
open defecation free and given a certificate.
So how soon?
That's the step.
How soon will we begin to see a change on this route with the deliberate construction of public toilets to check open defecation?
I think Rome wasn't built in one day, and it's a two-pronged approach. The government will do this, and the public also must engage with us and use those facilities. Many a times you see the facilities are there, but the people don't use them. So we, with the help of the media, I think we need to educate the public that this practice carries a lot of danger to the entire population, and we must all desist from it.
Dr. Coker, we also talk about children. Are there special programs to ensure that these kids also know when they go to school, they know not to touch things or wash their hands? Are there special programs designed for kids? I mean, I understand that adults understanding all of what cholera is about, but the children, the kids have to understand that aspect especially. So is the government doing anything in that regard?
We've done a lot of work in that aspect, particularly Ministry of Education, as I mentioned in my introduction. The health educators, which are nurses that are placed in schools at the assembly every morning, educate our children on the importance of personal hygiene, particularly hand hygiene. And we, as the Ministry of Health, we actually screen food vendors and make sure that they're disease-free and give them certificates. At the moment, we have inspectors out on the field inspecting food vendors in our schools, making sure that they have been certified disease-free. And those that are not, they're actually prosecuted for serving food around our schools.
It appears that we have, a connection challenge through to Dr. Coker, but that's also a very critical question. And, education and sensitization, not just for children, but also, for everyone across board, particularly in public places, how to how to manage, rather, preventive care now, how to manage the disease, and the supply of potable water is also very critical, which we're hoping that she'll speak to as well, such that, market women, meat sellers, they can better protect themselves, and, check the spread, the continuing spread of cholera. But, what we know so far is that there are 25 cases in Ogun State, affecting about 8 local government areas, and there's 1 death. But Dr. Coker says that they've stepped up surveillance in all of the local government areas. And in fact, she spoke to preparedness to the levels such that they have, ambulances ready, to ferry people who are affected to healthcare centers. And also, people have the responsibility also. We heard the doctor yesterday talking about knowing the closest PHC to get to if you ever come across with those symptoms, or if you have people around you who have those symptoms. The earlier you get to a healthcare facility, the better. So we also have to be responsible for ourselves, be accountable for ourselves, and also the children. Well, and Ogun State is also, one of the flood-prone states, and from our conversation last week, we're not even in the peak yet. We're not. July will be upon us very soon, and that is the peak of the rainy season. So we have to also step up preventive care ahead of that time, such that we protect ourselves against this cholera epidemic. But let's thank Dr. Coker for her time. Dr. Coker, who spoke to us, is the Commissioner for Health in Ogun State. Thank you very much. Up next, we turn our attention to Rivers politics as we try to understand the agitation of the 21 local government chairmen who protested, former local government chairmen who protested, and, if perhaps we'll find an enduring solution to the political crisis in that state anytime soon rather than later. So join us for that conversation. We'll be right back.